Here with Craig from Echo. Craig, what talk a little bit about, I guess, how as a fitness professional people can come and network with a physical therapist and kind of get an understanding of how to work with one and approach one. I guess a better understanding of what to do. I get that question a lot in my anatomy class.
Yeah, I think the first thing uh, that I would say, like when you go into it, because I guess what I can relate this to as far as like for me, networking is like when I go talk to a physician. I think it's easy for people to get intimidated by what they don't know, even though y'all know a ton already, especially just because I know the amount of training that y'all are going through with Show Up Fitness and everything that you're doing with Travis and the anatomy portion. I think that that's the biggest thing is just having the confidence when you go in. You don't want to go in and come across as like a know-it-all, but you also don't want to like you want to make sure that they know that your level of training and what you do is going to result in better patient outcomes. Because at the end of the day, that's what we're all here for, is whether we're trying to get people back to living their life on the rehab side or get people back to living their life optimally on a fitness side, we all have the same goal. So I wouldn't go in necessarily like nervous to talk to somebody because unfortunately in the world there's assholes everywhere. But the important thing is finding that person who you gel with and who you feel like there's a genuine connection and y'all see eye to eye on what you want for your client outcomes, if that makes sense.
Yeah, for sure. And it's, I tell a lot of people like when you're going to a physical therapist, they can only take somebody so far, right? Like they are only allowed a certain amount of time, whether it's like through insurance, but like maybe 8 sessions, maybe 6 weeks, depending upon how it goes. And so they need, competent fitness professionals to bridge the gap to get them where they want to go from there. So like leaving physical therapy, they want to make sure that they can have somebody in good hands that they can like, this person isn't going to hurt them. They didn't just take a test. They actually went through an internship. They have an education behind them. And so I think physical therapists like look, I mean, I'm sure a lot of physical therapists look at personal trainers like they're idiots, which I mean, I don't blame them. There's a lot of them out there that just don't know what they're doing and then maybe they get hurt and then back to physical therapy. But as a, fitness professional, I think it's important to actually go and talk to physical therapists because that'll make you different than the others that don't, right? Because you're actually like humbling yourself. You're approaching somebody, you're talking to them, and you are, hey, what do you think I should do with this person? Like just back and forth, like just kind of brainstorming like you and I have done in the past. And I think that kind of shows the physical therapist that, okay, this person isn't the average personal trainer. Like he's going to maybe take my client to where they want to be instead of just like let's do box squats and let's jump off this box and like crazy stuff.
Yeah. Yeah. And I agree. I think that, like, just on the subject of you talking about that, it's like, I think it's just as important on your side and the fitness professional side to find a physical therapist that they trust because you don't know when you are going to have a client who might be in need for rehab or physical therapy. And just like you were saying that there's a lot of personal trainers out there, unfortunately, that aren't great, there's a lot of physical therapists that aren't great. So I would say that even like on your side of when you're trying to find somebody that you trust from the physical therapy side or that you align with, like it's just as important that you follow like what you know, like, and you vet out the physical therapist just like you would expect them to vet you out. Because you can go to a regular mill clinic where, unfortunately the physical therapist is seeing five, six people at a time and they're doing all the same standard protocol. Like I would even argue that like a good individualized personal training plan is better than that. And so I think it's important to find, a physical therapist that doesn't just look at numbers, but looks at the person individually, if that makes sense.
Oh, for sure. And I completely agree because as you know, I've been to a million physical therapists and some of them are like, what are you even like? I can do
Yeah.
this at home. Like this isn't doing anything, like the PT meal that I have been to, and they just kind of like scratch their head and look at me and they're like, just give me this piece of paper to do. And I'm like, that's what y'all are doing? Like, you're not even like engaging with me. You're not making sure like I'm doing the exercise properly. Um, and that is pretty rampant out there, especially with, I guess, insurance, right? Because
Yeah.
which you guys are a cash clinic, you've been on both ends of it. And from
Yeah.
talking to you, I think you like the cash clinic side better instead of taking the insurance where you're stacked and stacked and stacked with people, but you don't have the time to actually care for the people and do what you enjoy doing, right?
Exactly. Exactly. And I think that that's like, and I probably get repetitive, but like, at least for me personally, like when I talk to a personal trainer, I want to see that they value what they're doing as much as I value what I'm doing. So, like, to see people who care enough to continue to push their education, and I'm not talking about like education as far as like go get this degree or that degree, but who care enough to keep up with, the most recent research, who care enough to keep up with new techniques that are coming out personal training wise. And even just like on your end, like who care to learn the anatomy. Like to me, I think somebody who knows the anatomy, like once you know the anatomy and the musculoskeletal anatomy, actions, origins, insertions, like that's the ultimate power for a personal trainer, fitness rehab professional, because at that point, you can basically identify anything once the actions of the muscle. Like, okay, well, if this isn't firing, this is going to cause a chain reaction with these other ones, like these other muscles, if that makes sense.
Mm-hmm. And a lot of times, like, there's a million assessments out there, and I made comments about them, but I think understanding like biomechanics and anatomy is super important in like just watching somebody squat, right?
Mm-hmm.
Like you can see somebody squat and how their muscles are supposed to move, and it's like, okay, well, let's adjust this, this, and this, and then you get them to squat perfectly, and it's like you didn't have to use all these crazy techniques that are out there because you understand what's going on at the hip, you understand what's going on in the knees, the ankles, you know, and so it's a really powerful tool, just assessment wise, because
Yeah,
it's like a
exactly.
little superpower.
Yeah, exactly. And the unfortunate truth is, like, with most education, even up to, I would argue, like the physician level, most education we get is based on, not, am I allowed to cuss on here or no?
Yeah, whatever,
Okay,
say whatever you
not
want.
not fucking somebody up versus like actually getting somebody better. And so it's like to know the anatomy, like you're saying, and to have that superpower of being able to watch somebody move, identify, one or two things that you need to work on those one or two things. Like you're going to make a bigger impact on that person's life than most healthcare professionals they'll see. And I'm not trying to like dog on healthcare professionals, especially because I'm one, my wife's one, but it's like, we all get caught, and like all healthcare professionals get caught in the system. And that unfortunately leads to patients being caught in the system and clients being caught in the system. And it turns into, okay, well, 90% of people with back pain need to go do this versus let's dive into why do you have back pain? What's going on with back pain? Like what other factors in your life do you have that are affecting your pain? And to me, that's anything that anyone can do. And a lot of times, like just helping people, and obviously you want to stay within your scope and you don't want to go outside and like recommend medications or anything like that. But you can make simple recommendations like, hey, you probably need to drink more water, or hey, you probably need to get outside and get more sun. Stuff like that's going to make a huge difference along with your care plan of we're working on strengthening this or improving mobility here. You can make like a huge difference and honestly save people a lot of time and money from having to get caught in the system and just kind of repetitively go, to this doctor who's going to refer them to this doctor who's going to refer them to this PT who's in a mill clinic where they're not going to get better. And then they're going to go back, get a shot, get more meds. I mean, I think y'all and, you know, in a cash-based individual physical therapy clinic, personal training studio, like we have the ability to change lives and prevent people from going down an unfortunate path where they're just constantly caught in the system and not getting any better. I don't know. That was a long tangent, but
No, I
I hope
love it
that makes
because
sense.
that's exactly what we both talk about. Is like healthcare sucks. Like
Yeah.
healthcare, like that's healthcare sucks. And it's rigged against the person in a way where I guess I think I told you a story about the client that came in with back pain and her doctor said, just take your muscle relaxer and lay in bed, and just relax until the pain goes away. And I was like, in my head, like you can't say that to a client that that doctor is like wrong because they're a doctor, right? And it might
Yeah.
work for some people, but I told her, I said, if you come in, like I'll get you out of pain, you know? And if I don't, your next session is free. So she came in and she said she visibly laughed. Like she's like, can you believe this guy? He thinks he's gonna get me out of pain. This is her second session, right? We did an assessment. And this was like we did a quick little workout, and then she flew to Las Vegas, came back. She had back pain, and she was like, he's not gonna be it. Like whatever. Like I have to go to the chiropractor today. I'm gonna take a muscle relaxer, like all this stuff, right? And all I did was do simple maneuvers, right? Little pelvic tilt, like leg out, and then bring it back with your adductor muscles, cat cow, um, nerve glides, and then just a few other things. When we did that for about 30 to 45 minutes, I did some soft tissue mobilization. And she got up and she was like, holy shit, I can't believe I laughed at you today. And I was like, what do you mean? And she was like, yeah, like I actually like laughed like you weren't going to be able to fix me. And I was like, yeah, I know. I understand. Like it's like personal trainers who look like freaking idiots, dude. And it's you know, it's not wrong. There are a lot of idiots out there because they just get a paper and they take a test and that's it. But you know, like to your thing, healthcare sucks. And it's not like those doctors are not up on like motion is lotion. Like let's move you, let's make sure that you can rotate, flex, extend, and just make sure that your body is overall, you know, moving properly. So it is, you know, it's like a little superpower to have a physical therapist in your pocket to talk with. Like, and I asked you about it, and you're like, yeah, that's all the right stuff. And you agreed. You're like,
Yeah.
yeah, healthcare sucks. Like that doctor, like why would you just lay there still like that? That's going to lock everything up even more, right? Like that's, and I kind of explained that to her, and she had just started a new job. So I explained like the cup theory, where you feel so much in, and then like eventually, like just a little thing, and it overflows, and you have pain, right? Like that's kind of the way I explained it to her, and she understood that. But she, like, even today when I trained her, she was just like, I can't believe I laughed at you. Like, I feel so much better. Like, even after that session, I've seen her like a few more times, and she's progressively getting better. And she's amazed. She's like, you obviously know what you're doing, so whatever. So
Yeah. And
it's
I
pretty
think
cool.
that from a personal standpoint, that's like one of the most rewarding moments you can have as a fitness professional, provider, physical therapist, what have you. Like I remember I've had patients come in the past who are like, I have a bad experience with PT, like it doesn't work, it just wastes my money, blah, blah, blah. And it's like you kind of go through that process of like, well, I just want you to like, you know, trust me, try this. And if it doesn't work, fine, but like at least try this. And then if you can turn somebody a non-believer into a believer, I mean, you're taking that person to where now their first go-to, rather than, oh, I need to go to the doctor or I need to go to urgent care to get meds, their first go-to is like, okay, I need to do A, B, and C as far as movement goes to see if that clears it up. Or I need to ask Travis what he thinks, or I need to ask Craig what he thinks. And that's like, I think, you know, not only rewarding personally, but it's an amazing, like, life altering moment for somebody in pain, you know, that connect those dots in their head of like movement is good, correct movement is good, sitting is bad, you know, and just like
Hmm.
letting it continue to fester is bad.
Yeah, and that's the point of like just, you know, people go out there, talk to physical therapists. Like they shouldn't be so afraid to just go into a PT clinic and be like, "Hey, can I talk to you for a little while? I'm a personal trainer and I've got this certification. I know I'm studying anatomy, or I've got this client with this. What do you think? Can I pay you for an hour of your time? Like offer something to the person. Hey, if I buy you coffee, can I shadow you for the day? Is there a
Yeah.
possibility that I can come and I had a client with back pain, come and watch you treat somebody with back pain? Like how if a personal trainer came to you with those kind of things, like, hey, do you mind if I shadow you for a day and see kind of how it goes? And what would you say to that personal trainer, and what would your feelings be? Like I guess what would your reaction be, how somebody would approach you?
I mean, I would definitely welcome it. And that's just me. I think it depends on the setting you're walking into. Because, like, if you're walking into a mill clinic, kind of like we talked about, unfortunately, most of those guys are overworked, tired. They're from, long hours doing a bunch of notes. So, like, their time is very limited. So they might be kind of rolling their eyes, like, I don't want to answer a bunch of questions when I've already got, 4 hours worth of paperwork I'm behind on. But I think the important thing to me, and that kind of circles back to finding the right person for you who you want to shadow, because just because somebody has the credentials of DPT or PT or whatever doesn't necessarily mean that you're going to get a whole lot out of it, depending on what their situation is. So I think, finding, like, do some research in your area of clinics, try and find like a low volume cash based clinic and approach those guys. Cause I think for me, like when somebody comes in here and asks those questions, I mean, I'm fired up. I'm super pumped to talk to them about it. And heck yeah, like you can come and shadow me and we can kind of collaborate and work together and, bounce ideas off of each other like we've talked about. And I think, the biggest thing is like from the beginning, don't be intimidated to put yourself out there. Cause I know that even just like socially talking to somebody new is nerve wracking. And especially when you feel like you might be a new personal trainer and you're trying to kind of get your footing, like you might be nervous to go talk to somebody who you feel like has a lot of knowledge, but like you all have a lot of knowledge with the training you are going through. And I think the biggest thing is like, if you care about your clients, to me, that's all I care about, because other than that, we can work through stuff together where I might have pitfalls or you might have pitfalls. We can work through it together of having that sense of like humility and that sense of caring for your client, basically. I don't know. Does that make sense? I feel like I rambled a lot there, but
Yeah, no, it totally does make sense. And I mean, a lot of people probably should find a cash-based clinic to go and talk to, because I mean, I've seen where you came from. Like you came from a place that was like kind of a PT meal in a way. And you guys had no time. Like you were like just burning and turning, right? Like nonstop. And so if somebody did come in there and was like, "Hey, can I watch you?" And you're like, "Oh God, dude, like I can't even get a break when I go to take a shit," or like, like I
yeah,
just need that time to like hide for a minute. Like I completely understand that. So how, I guess, would a personal trainer discern whether they are going into a PT mill or a cash-based clinic? So how do you decide, just by even looking at the website or like making a phone call? How do you figure that out?
I think honestly, the big thing for me is like, how easy is it to even get a phone call across or a phone call back, So, like, if you see a clinic and you call and you get a secretary who's like, well, I don't know, they're all with patients or whatever, and kind of blows you off, then that's a pretty good indication that it's probably not a great, situation and it's a pretty overcrowded situation. But if you call and you get either like a secretary or even a PT on the phone and they're, willing to talk to you, that's a pretty good indication that that's the place to go. Uh, and it's, if you do call somewhere and you don't get a hold of them, I'm pretty persistent. So I would just go in person as well, and even just talk to the receptionist and kind of ask them some questions about the practice. And then if you don't hear back, call back, just stay persistent with it. Uh, but I think you'll be able to discern pretty quickly if it's a place you want to be or not. Usually the places that are larger chain, like that you see like, I don't want to say any specific places, but like if you see like
Like a
pro
results,
PT and you see,
I'll say it.
yeah, and you see like 10 of them across your local city, then that's probably a good indication that it's more on the mill side and they're going to be burning and churning versus more individualized care. But if it's like a PT clinic within a gym, that's awesome. If it's like a boutique, can't speak. If it's a boutique PT clinic where it's just like a little studio, one or two PTs, I mean, I think that that's a great place to be.
Yeah, for sure. No, and that's and once I heard you guys kind of started your own thing, I was like, oh shit, that's awesome. Like, good job. Like that's I think everybody's little dream is to have their own thing, right? I
Yeah.
mean, I would hope that maybe it's not everybody's dream, but some people probably like the burn them and turn them stuff, maybe. Or they just or maybe they just
Some people just like to clock in and out.
yeah, some people do like to clock in and out, but
And
whatever.
I don't want to be like in this conversation, I'm not crapping on doctors, PTs, anything like that. I'm more crapping on the system that we have in place because it produces people like that and it forces people to be that way versus, having the time to be individualized. Because honestly, like I would absolutely love it if we could take insurance at our clinic and still give people the same time and attention that they need. But that's just not how it works, which is unfortunate. So a lot of these big places have to see that many people to stay afloat. And healthcare sucks. And that's the
That
bottom
is
line,
the
unfortunately.
healthcare does suck. Yeah, it it's not made to benefit people in a way. So yeah, it does suck.
Yeah.
It kind of keeps people in the system. So yeah, no, I completely understand. You're not shitting on anybody. You're shitting on the system that we have in place
Yeah.
because um I see the difference in happiness in you where you are now compared to where you were as far as like just, stuck in that, you had to grind. So you had to grind to get where you are, right? Like you had to
Yeah.
start somewhere. And then, but you had a vision in place of like, I'm not always going to be here. I'm going to be here
Yeah.
for a little while. So yeah, some people do have to be in there until they can create their own thing and learn those skills and go through enough patience maybe to be competent. Um,
Yeah. And I
and
think that also brings up another good point on your side. And it's like if you're just finishing up your certification or your NASM or, whatever certification you're going through or training you're going through, I don't think that there's anything wrong with going to work for somebody else or somebody who has a little more experience, see what you can gain from them and get your footing because a lot of it too, like, and I feel like this is very parallel between PT and personal training. You learn the stuff that you need to learn knowledge wise, but then you have to learn how to communicate with people. Because if you have all this knowledge, but you don't have the confidence, like you even telling that lady, like, hey, come in and I'll get you out of pain. You have the confidence and you have the knowledge. But if you have one without the other, like if you just have knowledge and you're like, oh, well, maybe we can help you, then you're not going to be able to you're not going to be able to make the impact you're making now. So, like, there's nothing wrong with going to work for Lifetime or, Gold's Gym for a little bit just to get that experience and reps in of communicating with people. But you'll know when it's time, like, okay, I can do more than this. I'm ready to where I can start pulling my own clients in. Because I think, talking to you, you had a similar situation where you were at before, where it's like, you went in, you were personal training at a facility for a while, and then you got to a point where you're like, okay, I don't agree with everything we're doing here. I want more time with my clients and I can make a bigger impact on my own. So like I think that there's no wrong way to get there. You just got to take the steps and kind of like you said, grind it out, if that makes sense.
no, that's exactly what I tell personal trainers is like find somewhere where you have a high volume of people that you have to progress, regress, that you have injuries, that you have from young to old to like just get and train as many people as you possibly can in your first like year to 2 years, 3 years, right? Like you will learn so much by just keeping your head down, reading, and just, you know, burning through people. And then as long as you're a fairly competent person and you can communicate, like you said, like, because if you can't communicate, then that's, you know, because you got to keep a conversation going the whole time. Like,
Yeah.
I mean, with some people just, you know, they kind of want to be quiet, but you're going to be a much more well-rounded people with all those experiences than just somebody that gets like one or two people and then they train them and then they have a break and then another two people. So it's being able to like progress and regress exercises on the fly and just, you know, understanding anatomy and just building your knowledge base to where you get to where you're like, I think I can do this on my own.
Yeah.
And then
And a big thing is getting comfortable telling people they suck at something, you
yeah,
know?
yes. In a nice way because you're
Yeah.
like, nope, not like that. Let's hips back, knees forward. All right, yep, that looks better. You know.
Yeah.
So yeah, like you're not good at that. Let's change
Yeah.
it up.
Yeah, for
So
sure.
no, appreciate you taking the time out for this conversation. Um,
Yeah. I'm always happy to talk about this stuff. I mean, I love I love talking to anybody and everybody about PT, rehab, fitness, all that. So I think that, I hope we can talk more about it.
hell yeah, dude. We'll have to do another one of these on another topic. I mean, we touched a lot of stuff, but I'll post this and you can share it to your Instagram or whatever, and we'll do another one.
Sounds good. I appreciate it, Travis.